Welcome everyone to this NISS meetup on the topic of how to present your research. We're glad that so many of you could join us today to hear our distinguished panel of speakers. And we're very grateful that our speakers were able to make time today to share their experience and their expertise with us on this topic. And we'd also like to thank the newly formed NISS Graduate Student Network for coming up with this idea of having a meetup on how to present your research. So here's our schedule. We're scheduled to go for an hour and a half today. After my welcome, oh, by the way, I'm Kate Crespi. I'm a professor in the Department of Biostatistics at the UCLA Fielding School of Public Health. We have 4 distinguished speakers today. We'll have who will be each speaking for about 15 minutes, and that will be followed by about a half hour of questions and answers. Our first speaker will be Regina Nuzzo from the American Statistical Association. Then we'll have John Baylor from Miami University, and Jim Booth from Cornell, and Susan Ellenberg from UPenn. Some logistics. So the hosts for this webinar are James Rosenberger and Glenn Johnson. If you have technical issues, you can contact them in the chat box. As far as asking questions, questions are definitely welcome. And in order to ask questions, could you please use the Q&A feature? You'll see there's an icon at the bottom of the Zoom window, and you can type in your questions for the speakers there and hit enter. And we will have the Q&A session during the last half hour, so we'll be saving that until the end. Some more logistics. By now, many of us are familiar with Zoom. We're experts now. But a tip for those who may be new or don't know about it, when the speaker is sharing their screen, you can minimize the video display of the other speakers by clicking on speaker view or gallery view. That'll be on the top right of your Zoom window. Also, after the session, you'll receive an invitation to evaluate the session, and NISS finds those evaluations very important. So we thank you in advance for filling out the evaluations to improve future offerings. And also a link with a recording of the session, and the slides of the speakers will be available on the NISS website, usually within a day or so after the webinar itself. So with that, we can get started with our first speaker, who is Regina Nuzzo, who is Senior Advisor for Statistics, Communication, and Media Innovation at the American Statistical Association. And welcome, Regina.
Okay, you got it. Can we see everything? Awesome, thank you, Kate and everyone. I'm happy to be here today, where I'm going to talk about how to talk about your research to aliens, AKA non-statisticians. First of all, my disclosure, I'm a cyborg, which means I'm deaf with a cochlear implant. And if you notice that there are captions available, that's why. Please enjoy them also. And if you ask a verbal question and I don't quite get it, that explains that also. But my deafness also explains why I'm so passionate about clear communication, which is what I am going to talk about today. So why even bother trying to talk to aliens about your work? One, because they're often the creatures that are signing the check. They have the money, they sign your paycheck, or they're the funding agency where you need a grant, or they, control the gold deposits on Jupiter. Lots of different reasons. Oops, sorry about that. Two, they often have a platform that help make decisions that affect something, you or the world. They are government policymakers, or they're journalists, or they're, the alien overlords. They are doing something, they have control. And third, but not least, they are often smart and curious, but they just don't know very much. But you don't want to make them feel dumb, because they might be our new overlords, and we need them for things. So that leads to my secret formula, which I've adapted from a very popular maxim in journalism. To be an ideal communicator, you should, one, overestimate the intelligence of your audience and underestimate their knowledge. That is, give them credit for being smarter than they probably are, but then also assume that they are probably a little bit more distracted, or less widely read, or less knowledgeable than you really think they are. And an alternative to that quote, if you don't like that one, is a direct quote from a magazine editor back in 1923. The ideal magazine article should be written as if the men and women who were to read it had just dropped in from the planet Mars. Nice, right? So they're smart, but they're kind of clueless. So how do you do this? That's what we're going to get into. Here is one easy template you might want to experiment with, and we use this a lot in science journalism. First, you start with what the setting or the context is, then you talk about the problem or the question that you're trying to answer, then you cover the so what, or the who cares, or the why is this important. Then finally, you get to the solution you're proposing, or the answer to the question that you found. And then you round it all out with the benefits, or the next steps, or the perspective. So notice that if you give these equal weight, you've got about 60% in the lead up before you actually get to the amazing thing that you've created, the solutions and the benefits. So it doesn't need to be quite these proportions, but I do very firmly believe that you need to take more time than you think for the background. You need a lot of background. And so that leads to few guidelines. One, give even more context for the problem than you think you need. Can't emphasize that enough. Two, replace all these specialized terms with simpler terms. Not too hard. Replace abstractions with concrete nouns, concrete verbs, and examples. And to follow my own advice, I'm going to give you an example of a stats abstract that was written for JSM of this year, and then the lay language version of it that I wrote to make available to journalists. So journalists would be my alien audience. So I am just going to read part of this to get you the idea. And I'm sorry that, okay. Did that make it any better? Yeah. Okay. Intravenous busulfan is a standard component of the preparative regimen in allogenic stem cell transplantation for acute leukemia. Systemic busulfan exposure, characterized by the area under the plasma concentration curve, AUC, is strongly associated with clinical outcome. A high AUC is associated with severe toxicities, while a low AUC carries risk of disease recurrence and graft failure. An optimal AUC interval is determined for each patient by giving a preclinical dose, and to determine if the optimal AUC interval varies with individual patient characteristics, we developed a method for determining covariate specific personalized AUC intervals. Okay, you get the idea here. So let's see what happens when I apply my template here. So first off, I would say, what is the setting? And I can find the setting here. We're talking about leukemia, we're talking about allogenic stem cell transplantation, and we're talking about something called busulfan. But that is, I can't just give that. I need to back up and set the stage. Just very quickly, what is leukemia? What is allogeneic stem cell transplantation? Why do we have Bolsafan? So I've had treating blood cancers like leukemia sometimes calls for the aggressive approach of transplanting stem cells from a healthy donor into a patient's bone marrow. To help prepare the patient's body for this transplant, a drug called Bolsafan is injected directly into the veins. So you can see I backed up, I gave some context. I didn't just jump right into we have this Bolsafan thing. I even explained what leukemia is. I feel like this is super important. Okay, the problem then, what is the problem? We have this drug's AUC, it's associated with some sort of clinical outcome. The thing is, this doesn't sound enough like a problem. So when I did this, I changed the tone just a little bit. It's tricky to get its exact dosage correct, however. So notice that I used the word however. That's a signal to my audience that something isn't perfect. It's a but, it's a however. It gets your attention. It creates this tension, and you need that tension in order to keep the audience paying attention and asking, okay, what happens next? Where the audience wants to relieve that tension that we've just set up with that problem. Then we go on to the so what. So we need to heighten the tension here by really driving home to the audience that not only is there a problem, it is a very important problem. It's a big problem. And here it's that too high of an AUC has toxicity and too low is disease recurrence and graft failure. The thing is, this isn't really in plain English. So, and it's abstraction. So can I do better? Too much of the drug can lead to toxicity or even death, while too little can make it easier for the cancer to return. That works. That's in nice, plain English. I have death in there, so you know it's important. Cancer returning, well, that's something good there. All right, now we're finally ready for the solution. And we've developed this covariate-specific, personalized AUC intervals, et cetera, et cetera. Okay, so this is great, but our non-statistician, alien Martian is not going to understand this. So I changed it to this. In this presentation, the researchers describe the new precision medicine statistical model that they created to determine the right dosage for any patient. This results in a method that can be easily used by any transplant doctor. So here I knew I was writing for journalists that would perk up if I mention precision medicine, so I put that in there. But if you're talking to a different audience, you're going to highlight something different. So I emphasized also the point in here that I thought would be easily lost if you're just reading the technical version, that it determines the right dosage for any patient, and then it's a method that can be easily used by any transplant doctor. So I really wanted to highlight this is a solution to the problem. And then last, the benefits. So simulations showed this just well compared to other models. Statisticians are going to get excited about this, but our journalists are not going to be jumping up and down. So I asked the presenters to give me something that wasn't in their abstract. I asked for more patient-oriented benefits, even if they were only estimates, just to give me something to work with. So I said, by switching from the current one-size-fits-all strategy to the new method, the researchers calculate that doctors can extend many patients' lives dramatically by an average of 10 to 14 months, for example, which is an improvement up to 290%. And here it is all together. Oops. So some of you might be saying, okay, what if I needed to give more information on the actual solution, on the statistical part? Should I make number 4, bigger? Because right now I have it about half, for 1, 2, and 3, and about half for 4 and 5. So what if I need to bulk up 4? What should I do for that? Do not just make 4 longer. Do not. So this is what we have right now. I say keep that. And what you do is then do like a spiral. Use that as the new setting. Use that as the jumping off. Have that entire paragraph be like the setting where you go into the deeper statistical problem. You go into what are the statistical problems and why are those statistical problems important? What's the statistical solution and the benefits, right? So it's like you iterate, you circle around. That's what I would recommend. All right, and last, I want to leave you with a fun game to get you into the mood for talking with aliens. And that is explain your work using only the 1,000 most common words in the English language. And for this, I love to use Randall Munro's Simple Writer through his XKCD site. And let me show you an example. You put your words in here, highlights in red anything that's not in the 1,000 most common words. And then you say, okay, can I rewrite it so that it's all black? So here's p-value according to Wikipedia. Standard definition we always know, and this is p-value according to Regina's Simple Words. A number that tells you how surprising another group of numbers would be if everything happened just by chance. Not perfect, but you get the idea. All right, thank you very much. I'm happy to answer any questions now, or I think we have it later during the Q&A, or you are also very welcome to email me. Thanks.
Great, thank you so much, Regina. That was a wonderful presentation. And if there are questions, please feel free to put them in the Q&A box, and we'll pick those up when we get to the Q&A session at the end. So, but for now, we'll go on to our next speaker, who is John Baylor. He's a University Distinguished Professor and Chair of the Department of Statistics at Miami University, and he's also president of the International Statistical Institute. So, thank you, John.
Well, thank you, Kate. And, thanks a lot, Regina, for giving a great talk. I mean, I usually hope that the people before me will lower expectations. So I appreciate you raising them by doing such a brilliant job. It's my pleasure to be here, and I'd like to thank NISS for hosting this and for the opportunity to come and talk to colleagues here, and also to share the panel with outstanding colleagues. I'm going to talk a little bit about just some things that included Efren's 13 rules for giving a bad talk. And I'm going to give a tip of the hat to Jessica Utz. Jessica and I did a talk a few years ago, and we talked about getting ready to give a good talk and what does a bad talk look like as preceding that. Perhaps I'm exemplifying that now just in what I'm doing, but I hope not. I hope that if I started the bad level, I hope that I'll finish up at the good level. So the idea is that we're going to look at some of the things that you can do badly with talks, and then trying to circle back to think about what it is that we could do to improve how we present. So the 13 rules this was part of a publication that came out many years ago, and you'll see the citation a little bit later. But first, you don't want to plan carefully. I mean, because planning is the death of interest. I mean, it should be a good improv. I mean, the best experience is one that doesn't really have this burden of planning and preparation. Secondly, you can thank as many people as possible. And, if you take enough time thanking people, you don't have to worry about having a lot of content beyond it. And there's obviously Jessica had to include this, thanks to Brad, and I would echo that. Don't go down the proverbial rabbit hole of just this minutia that you get tied up on a particular point. Yes, time is of the essence. I mean, you do have people that beautifully time their talks like Regina did just before me. And, there's an aspect of kind of just understanding rhythm and flow of what a talk looks like. And so you have to think about what that is. And part of it is if you get caught up on something that really doesn't matter so much, you're going to miss out on the opportunity to tell the stories about what you do care about and what is important and your message. You can have too much outline and not enough content. So part of it is you want to create expectations, but you don't want to be too preachy about all that's going to be there. Again, you don't want to waste the time motivating a talk. because people are there and they know why they should be there. I mean, please be taking this, this is not intended seriously. Remember, this is the bad part of the talk. So, yeah, you want to make sure that, probably it's the opposite of the things that we're saying here at the front. So yeah, so clearly a motivating example is horrible, because who would want to see that at the start of a talk? Is abstraction is beautiful, and we can just embrace the abstraction without having any sense of how it might be applied. Is the more detail of a notation, the better. I mean, you don't want to be, kind of hung up on on accessibility of the content to someone in the audience. So make sure it looks like the most nightmarish of kind of a formulaic ANOVA table with all the calculation formulas embedded within. And you don't want to waste blank space. That there should be, everything should be there. It should be all available to you. You don't want to miss out on anything. Tables are a gift. I mean, because from tables you gain insight, and the more detailed, the better. If 2 rows of a table is good, 20 is better. And if you can show that on the screen, it just really is a testimony to all the quality of work and all that you've contributed. Clarity of expression. You should, try to be chewing gum and be distracted when you're speaking, because you don't want to articulate your message, because who could possibly want to follow? If they're not in the front row, they probably don't care anyway. So don't worry. If you can bounce back and forth, all the better. It doesn't matter if there's a little bit of vertigo that's induced by people that are in the audience, as long as they can see everything you've done 2 or 3 times is even better. If you've done it, if you've been learning it, you should show everything. You should tell everything and you should tell everything you've done. And it doesn't matter how much time you've been allotted. That's the goal and aspiration of every talk that you give. And then, oh, wait a minute. Is my time up, Kate? Well, then I got to hurry through this, because I got another 10 slides, but I'm sure you can hang in there for the rest of this. Now, this is the cartoon, and to the cartoon of this, Jessica added some other categories about the clarity of speaking, back and forth between your slides, trying to not get caught up, blah, blah, blah. You've seen all this. The source that here is, this is chapter 52 from this book, Past, Present, and Future of Statistical Science. The additions from Jessica are, kind of highlighting the importance of acronyms and abbreviations. People always love them, and they always respond to them. Practice doesn't make perfect. Practice just, it dulls you. You won't be able to do the talk if you practice too much. And heaven knows timing doesn't matter. That's just not critical. So at this point, perhaps I've exemplified all of these bad habits that we've just highlighted. And that's not where you want to be. But there's advice that you can find that's well worth considering. And I will, I certainly tip the tip of the hat, as well as to Jessica, but also to the ASA. And you'll see that there are presentation tips that come out before the joint statistical meetings and also before the conference on statistical practice. And there's lots of components. And some of this, in a lot of ways, I think it resonates with what Regina was saying. Particularly, the setting is there's mapping of some of the things that Regina said directly into this. You want to think about content. What does an effective display mean? Timing your talk, some of the details, and a little bit about when you're finished. And I'm going to give some of the ideas that ASA has here, and I'm going to report out, but I'm also going to elaborate and extend it a little bit on things that I think about in this context. Again, I feel like this is Regina, I'm going to celebrate kind of the early start of yours, and that is the setting and the context for what we're doing. What is it that you want people to take away from a talk? I mean, that's a critical aspect. And if you don't remember anything that from what I'm saying in this talk, you may say, oh, there were these rules for doing a bad talk that I can go look up. And there are these methods, these guidelines, these tips for giving good talks, and I can find them here. So even if you don't remember anything that I've said, there's something that you do. Now, what's the problem and why? Well, the problem is that we're thinking about how do you do better presentations? what's been done about it. Well, I'm not reporting on research, but I am reporting on what's been done because I'm reporting some sources of people that have thought about this and have done a good job in providing advice and guidance. What I'm doing about it is I'm going to extend some of these based on my own experience and talk a little about the context. And that's where, I hope that there's going to be value. And then there's some places for where you can go from here. The other part that I've thought a lot about, and some of this is my collaboration with journalists, is, respect your audience. You don't want to bludgeon them with facts and context and detail. You want to be able to bring them along so that there's value added. The outlines are critical to give you context for what's going to happen, and also tell them what to expect, then report, and then recap. Okay. Timing. You got a budget. You got a certain amount of time, like 15 minutes, say for a NISS presentation. Let's give as an example. So if you have 15 minutes, you should be, thinking about what you can do and how much time it's going to take to do it. You got to describe the problem. You want to leave some time to talk about your contributions. And the other thing is, you can't talk about everything you've done at any talk you will ever give. You've got a certain amount of time. And if it's dense, and even if you talk quickly and you're talking to someone who, when I start on a roll, I can talk like a ferret on a triple espresso. I know I can talk very quickly, but that's not a value added for my audience. I need to find a way to connect. So we need to think about, what we can do in the time that we have. Context is a matter. You want people to appreciate the work and have a sense of why it matters. You want to give references and contact information so they can follow up. You certainly didn't learn and do everything that you're reporting on in 15 minutes, and you can't expect someone in the audience to be able to capture that in the 15 minutes that you have to talk about it. Keep your slides simple. And I've given the horrible example here. You probably can't see the text on the far right there. The color failed. And by the way, the other thing that you'll see is if you're presenting in a room with a projector, what the colors look like on your computer screen may not look like on a projector. So there's some value in testing. Find a font that people can read. 24 point is kind of my minimum when I think about presenting in a larger audience, and test it. I used to test things when I was give talks. I would have a hard copy of it and I would put it on the floor. And if I could read it without my glasses on, that was a success. I mean, you have your own little rules of thumb in terms of how you might do this. Limit it. And I said to 8, there's 8 lines per slide. That's an ASA rule. You got to find what works for you. And, think about the limitation on tables. It's better to have legibility than too much content. That's something that should be, circle back to this many times. And tables, generally graphs are almost always better. Get ready, prepare stuff for projection. And I've mentioned here about light letters. If you're, so Regina's talk would be, Regina's talk would have been better in a dark room than mine. I think some of the background would just pop out. That's part of thinking about what's going to be effective in the audience. Don't go through step-by-step and detailed derivations because no one's going to follow it. You didn't produce it in 2 minutes. You certainly can't report it in 2 minutes. Think about how you reference what you've done. Don't flip your slides. One of the things that I often do is I'll often take what I have as a slide and I'll put it up on my webpage. And so someone could download it after I do the presentation. Think about making your work accessible. And we've talked about the color issues. You may have gotten the 15-minute slot, but you have more than 30 minutes of content. Don't succumb to the temptation to try to do it. Think about how many slides you can do. Some people say a slide a minute works for them. I tend to think about less dense slides and more slides. So for me, a 15 slides in 15 minutes is generally not a problem. It's going to be very different. It's your style. That's where your individuality will show up in terms of what you're doing. But part of it depends on density and part of it depends on kind of, I guess I mentioned style and pacing. Again, speak slowly and articulate. And this is a serious concern. I'm involved in the International Statistical Institute, as well as being a longtime ASA person. If I'm meeting in an international venue, I have to think about how fast I speak. And further, I have to avoid kind of colloquial expressions. So you need to think about your audience and what they can hear. And the more things that are written and clear, then it's easy for them to follow. When I started out in my career, I used to give my talks to an empty room. And that was even when I went to the meetings. Now, I used to practice before I'd go to the meetings. And I would sit there and I would literally talk through my slides and time myself just to get the rhythm and flow and comfort with it. Invite your colleagues and talk through your slides with them. Get their feedback. See where you, and if you do that, when you practice about that, you'll see where the sticky points are. And that'll tell you where you need to clean up and clarify. You know, one of the things that you'll find, at least I did, and you know, my colleagues here on the panel may have similar or different experiences, I'll let them share, is that when I'm talking at the larger community, I tend to talk faster. That's just the nature of being in a public venue. So just think about that. You may finish a little bit faster. I mentioned here, if you're going into a setting, make sure you get there early to check the technology, check the mics, check the screens. Don't apologize for incomplete results. Everybody's doing work that's ongoing, so that's okay. Be comfortable with that. When finished, thank the audience for their attention. They took time out of their busy schedules to be with you, and it's worth acknowledging that. You know, be open to questions, and then once you're done, gather your material and let the other speaker come on. That's part of preparing. One of the things that I would encourage you to do is think about your social media presence and whether or not that's one of the ways you wish to be contacted or you wish to interact and share. You know, I'm going to say thank you for your attention at this time. And my contact information is here at the last screen, which includes both email, my URL for my homepage, and then 2 Twitter handles so that you can reach me. Again, thanks for the invitation and thanks for letting me join you.
Great. Thank you so much, John.
My pleasure.
Yes. And as a reminder, if you have any questions, please feel free to put them in the Q&A box and we'll get to those after our next 2 speakers. So now we'll go to our next speaker, who is James Booth, who's professor and director of graduate studies at the Department of Statistics and Data Science at Cornell University. Welcome, Jim.
Okay, I'm going to share my screen. Okay, so I'm going to talk about the job interview process and give some tips based on my experience as a faculty member for many years. So the context I have in mind is that of an interview for an assistant professor position. So typically the candidates would be fresh PhDs, or maybe they've been in a postdoc position for a couple of years. So I'm going to focus on 2 points. One is some tips for giving a successful job talk. And so much of what I have to say there will be similar to what the previous 2 speakers have talked about. And then I want to talk a little bit about the rest of the job interview process. One thing I should point out is that when I was preparing these slides, I was thinking about my experience as a faculty member and as being on search committees, being the chair of a search committee, and being chair of a department. And my entire experience of interviews was pre-pandemic. And so obviously there'll be some differences in the way interviews are conducted in this next cycle. And certainly in the spring, I expect that most, if not all, interviews will be done online, which will change the interview process somewhat. So, okay, so what about some tips for a successful job talk? Less is more. So as the previous speaker, John Baylor, emphasized, you're not going to be able to present everything you've done in a 50-minute talk. And so, you know, one successful strategy I've seen candidates use is to maybe take the first 2 slides or so to say, okay, here are some of the things I've done research on. Here are some of the publications that I have. But what I'm going to do in this talk is focus on a particular topic so that I can go into it in more detail. One thing to keep in mind is that if you're on an interview, the faculty, most of the faculty will have seen your CV, and so they'll have a sense of what you've done in your research career so far. So another point that has been made by the previous speakers is it's important to know who your audience is. If you're interviewing for an assistant professor position, the audience will consist primarily of the faculty in the department and also maybe the PhD students in the department, possibly postdocs if there are any, and maybe a few other people who've seen the title of your talk and think it looks interesting to them. But a key point is not to lose your audience. So don't assume that, so most of the faculty, most of the audience, including the faculty, will likely not be experts in your particular research. Presumably you know more about the topic you're going to talk about than almost anyone else. And so start off slow. Start with some simple motivating examples and slowly build the complexity of your talk. One useful strategy is to pause for questions when there's a natural break in your slide. Pause, ask the audience if they have any questions. Wait 10 seconds at least to allow audience members to formulate their questions. They may not immediately think of one, but if you give them a little time, they may be able to think of a question. Avoid proofs. Going through, I see this many times when presenters will say, oh, let me walk you through this proof with all the technical details. It's almost never a good idea to do that. The audience will not be able to follow it. Again, remember that you know your research extremely well. You've looked over these materials many, many times, but they are seeing it for the first time. So again, another point that's been made by the previous speakers is if you're presenting numerical results, avoid large tables. It's very difficult for members of the audience to decipher what they mean. If you are presenting results in terms of tables, one strategy is to highlight the key numbers, maybe do it interactively so the audience can focus in on exactly what point you're trying to make when you're discussing the results. But it's often the case that using charts or plots is a better way to present numerical results. But please explain what the plots mean. So if you have an x-axis and a y-axis, what exactly are they? Don't assume that the audience will be able to figure that out on their own. This is maybe an obvious point, but practice your talk. It helps to get the timing right. Practice with your fellow PhD students, your colleagues, your advisor, your committee. Look at what when you practice your talk, use a projector so you can see, as the previous speaker pointed out, what you see on your laptop screen may not look the same when you project it. And again, as I've emphasized before, include time for questions in your talk, during your talk, and also make sure there's time for questions at the end of the talk. And this last point, again, previous speaker also mentioned this, go to the seminar room early to set up. I find the most reliable way to make sure there are no problems is to put my talks on a thumb drive and to use the computer system that's in the seminar room that I'm presenting in. Some people like to use their own laptops. It's important then to make sure you have the appropriate adapters. It is, remember that most seminar rooms will be used by a variety of different groups from different departments that have different cultures. And it's, in my experience, it's quite amazing just how often there are technical difficulties prior to a talk. And the last thing you want to do if you're interviewing and you're nervous is to be more nervous about your talk because you can't, there's some problem with the projection system. Another point I should emphasize is that do wear a mic. Often you hear speakers say, oh, can you hear me at the back of the room? Just assume that they can't and wear a mic. It doesn't matter if your voice is loud, it'll just be easier for people to hear you. So what about the rest of the interview process? So a lot of the time during an interview for an assistant professor position is spent meeting with faculty. At least that's the way we do it here at Cornell. So each candidate would likely meet with, somewhere between 6 and 8 faculty members over the course of the day. These meetings are 25 to 30 minutes long. And so one way you can improve your chances is by doing some homework. Nowadays it's easy to look up faculty members online and get a sense of what their research interests are. And so it may be that you don't know exactly who you're going to meet until a day or two before the interview, but it's not that difficult to find information about faculty members' research interests online, and that will give you it'll help you in your conversations with individual faculty members. It's important to be able to discuss your own research at several levels, maybe at a high technical level, but also to be able to explain it to people who are not familiar with your research area. In most interviews, candidates have to meet with an administrator who may be a dean, or more likely an associate dean, who almost certainly will not be a statistician. And so it's important that you think about how you would explain your research to someone like that. So these other points, again, I'm thinking of situations pre-pandemic and hopefully post-pandemic. But one of the during your interview process, you'll be taken to several meals. Maybe you'll have breakfast with the chair of the department or the chair of the search committee. You'll have lunch with perhaps a group of faculty, and then there'll be a dinner after the formal interview process is finished. The dinners tends to be a more relaxing event where you can talk about things other than your research, but you can ask questions about the town or the city, and such as what's the cost of living, if you have kids or you're planning to have kids, what are the school systems like, and so on. Another common issue with people applying for academic positions is that they have partners, significant others who may also be interested in finding an academic position. And so there's a dual career issue. but you are not, as a candidate, you're not obligated in any way to talk about this issue. And in most cases, it's best to leave that until after you've been offered a position. There are occasions, I've experienced occasions where candidates have brought this up during the interview process. For example, we interviewed someone a couple of years ago who was also interviewing in another Cornell department, and his wife was also interviewing in that department. And he assumed correctly that we would know about that. And so the dual career issue was out in the open in that case. But that's probably a minority of cases. In most cases, candidates don't bring up the dual career issue until after they've been offered a position. So that's all I have. I'm happy to answer questions after the next speaker, and this is my contact information if you would like to send me an email.
Great. Thank you so much, Jim. I really appreciate that all of the speakers are covering a little bit different material. So I hope that the audience will find this especially helpful. So I'd like to introduce our next speaker, our final speaker, who is Susan Ellenberg, who is a professor of biostatistics, medical ethics, and health policy, and interim chair at the Department of Biostatistics, Epidemiology, and Informatics at the University of Pennsylvania Perelman School of Medicine. Welcome, Susan.
Thank you. Now, just tell me if the screen is right. Do I have the full screen on, or the one with the,
You're on the you're on the presenter one. So up to display settings, upper left-hand corner,
yeah.
and duplicate slideshow. And now back down to that podium.
All right. Sorry about that.
God, you got it.
Okay, great. So I'm a biostatistician, have worked through my career in mostly in the area of clinical trials. So I'm going to focus on speaking to a clinical audience, and I hope some of you in this audience are biostatisticians and for whom this will be relevant. So many years ago, when I joined the FDA, I was asked to work with other colleagues to develop a basic biostatistics course for the clinical reviewers. And I was a little taken aback when they said, one thing that's really important, we don't want to see any Greek letters. No Greek letters. Alpha's okay. They understand, at the FDA, even the clinicians understand alpha, but they don't want anything else. So what they're really saying is that they don't want to get overwhelmed in mathematical details. They knew that they had a whole big group of statistical reviewers to deal with that. They wanted to understand the concepts. And I think that is really good advice for any presentation to a non-statistical audience. And in fact, even as has been noted by some others, even for a statistical audience, another piece of advice I was once given early in my career is that nobody is ever disappointed by a non-technical talk. So what are you going to be presenting to a clinical audience? Well, you're not going to be presenting your dissertation work or your latest results that you published in JASA. You're going to be, you may be meeting with your group of collaborators. You're planning a study, so you'll be asked to present to them your ideas for design issues or aspects of the analytical plan. They will want to know how you think these data that they want to collect will be analyzed. You may be asked to present study results or study designs at a conference or some other general meeting, or even a seminar that will include non-statisticians. And you may be asked to give an expository presentation at a professional society meeting or a local seminar. Explain to people at a medical society meeting what the issues are with missing data in clinical trials or competing risks, something that will be a more general a general expository theme. So presenting study designs and analytical plans, you tend to be dealing with a smaller group of investigators, your own collaborators, and many of them will be fairly sophisticated. They will have been involved in previous studies, and will be familiar likely, or some of them will be, with terms like mixed model or Cox model, logistic regression. That's not going to upset them too much. If you're going to present something that's a little, off the beaten track, a little novel, make sure that they understand that and explain why, excuse me, why you want to use that instead of something that they may be more familiar with. And again, focus on the concepts. In these kinds of meetings, you should be prepared for informed suggestions. I've been in meetings where people have asked very good questions that show a fair amount of statistical sophistication. They may say, well, why are you just going to look at the difference between the first and the last time point when we're collecting that measure at other times? Why not do a longitudinal analysis using a mixed model approach? Or what about multiplicity adjustment? How you're planning to do multiplicity adjustment for the secondary endpoints? So, it's actually a good thing to have questions like that, to give them a chance to show their statistical chops. But just keep in mind that some of them are going to be sophisticated and others will not be. Now, as another speaker already said, plots are usually better received than tables. Plots are the most intuitive way to display data, and physicians in particular love bar charts, one of the simplest type of plots. The important thing is to keep the material as simple as possible while still being able to convey the main findings. Presenting tables, make sure that the entries can be read. If you have a slide that says, and you have to say, I know you can't read this, but get rid of it. Make another slide. Divide the data up into multiple slides if necessary, and avoid tables with large number of cells, which they're not going to be able to focus on. Another thing is to please don't tell your clinicians, well, we found no difference when you're presenting the results when the p-value is not quite under the magic threshold of 0.05. Physicians do this all the time. They put it in papers. And this is one of my main training things. Don't say, we haven't proven that there's no difference because the p-value is 0.07. So try not to let yourself say that. Let me say one more thing that I didn't put on this slide, but I was reminded by the other speakers about colors. Colors that look good on your monitor are not necessarily going to look good on the screen. I cannot tell you how many times I have seen plots with red lines on a black or a dark background. You can't see it. It looks fine on your computer, on your laptop, on your monitor. It does not look good on the screen. So really, if you're going to use deep colors, you've got to have a light colored background. So I'm going to give you some examples of plots that I have found particularly effective with clinicians. So this is a slide from a study where we were trying to show both the accrual and the dropouts. You want to have high accrual, that's great. You want people to be coming into the study, but you don't want people to be dropping out. So this is a bar chart, the kind that physicians like, that shows the total accrual. But at the top, the crosshatches show the number of withdrawals. So you can get a sense right away of who's doing really well. This is the highest accruing site, and they haven't had any withdrawals. That's really great. This one over here, that's the lowest, one of the lowest accruing sites, but they've got a lot of withdrawals, a higher percentage. You may want to go do some remediation with that site or have some more discussions with them to try and understand. But it gives your investigators the picture immediately. Here's another plot that I like. When you're showing during the study, you're trying to show how timely are sites with the times that they're supposed to bring people in for their visits. And what you'll see on this slide, each separate color is a site, and each line on that site is a patient or a subject. And the vertical lines represent the times that they're supposed to go in, and the dotted lines on each side of the vertical lines are the windows where, we say, well, maybe you can't make it on exactly the day that you're supposed to be in there, but you know, if it's within this window, it's okay. And then you see the marks that show when the visits actually took place. And you can see that, you know, for this site, they're pretty good around the times. For this site down here, the last one, there's a lot more variability. And again, this is a way to give a picture right away of what's going on. And it's important when you're trying to work with your collaborators to ensure good quality control in your study. And the last plot I want to show you, this is a study we were doing of testosterone treatment in older men. And we wanted to make sure that the laboratory that we were using to do these measures, we would send them the samples and they would do the measures, wasn't somehow, you know, being off. They didn't need to be recalibrated. So we had a sample from this CDC, from the Centers for Disease Control, where we knew exactly what the right value was. And you can see, and they did these runs every month. And what you can see is that early on here, the values that the lab was giving was very much higher than what the true answer was. And when we notified the laboratory, they said, okay, we see that we need to recalibrate, and they did. And things got better, and they got better. And then by the time you got over here, you started to wonder whether they had over-calibrated a little bit. But this is, again, a good way to see right away what the quality control issue is. You know, you don't really need to do anything fancy statistically to do some test for trend or something. You can see it right there, and that's what's important. So teaching about methods. Non-statisticians will often tell you that the worst class they ever took was statistics. I always hate to hear that, but I hear it all the time. Practicing scientists don't need to know, and they don't want to know, the formula or the analytical details, but they do need to understand conceptually why you're using a certain approach, why that might be optimal in a given situation, why other methods might not be optimal. And in particular, they need to understand the pitfalls of common approaches and ways to avoid them. So, for example, many clinicians still like the type of analysis called last observation carried forward, which is a single imputation analysis that's very suboptimal. Or they'll just simply want to just ignore the missing values. And it's important to explain to them why those are not the best methods and there are better methods to use now. Or another issue is sometimes you're looking to see whether, you know, that you're looking for numbers of events. And some clinicians will want to simply look at the number of events in one group versus the number of events in the other group when the event can repeat. And you may have an individual that has multiple events, and you have to explain that you have to account for the within patient correlation. You can't just add up the numbers of events. So those are the kinds of things that they need to understand, and those things can be gotten across conceptually. One thing you're always talking to physicians about when you're collaborating is how many patients do we need, what the sample size should be. That's one of the first things that you'll have to ask. You don't need to teach them the sample size formula. They can easily find a program to do the calculation. So this is not a good thing to show the clinicians that you're collaborating with unless you've got a fairly statistical group. What you need to do, what you need to explain to them is what the sample size depends on, that it depends on the size of the effect you want to document. It depends on the risks of a false positive and a false negative that you're willing to accept. That's fairly straightforward, and how variable your outcome variable is. They need to understand that the size of the effect you want to document is the major driver of the required sample size. And I have found that a really effective way to convey that is to produce a table of sample sizes varying the, typically would be varying the size of the effect that you want to detect with a given number of patients, because often the given number of patients is pretty fixed, and then they can see how that will vary depending on how big the effect is. Or you can, if you know what your minimally important difference is, you can look and see for different sample sizes what your power would be to detect that effect. And that's really probably the best way to convey how these different inputs contribute to sample size. So bottom line is you got to know your audience. Some clinicians know a lot of statistics, and if you're working with a group like that, you can use Greek letters, you can even use formulae and give more technical details. They'll love that if they're sophisticated. But if you're speaking to a large group to provide an overview of statistical methods, you've got to keep it as non-technical as possible, focusing on the concepts, using simple graphics whenever possible, and then be prepared to expand on technical issues when you get questions. So that's all I have to say.
Great, thank you so much, Susan, and thank you, everyone. Thanks to all the presenters for their presentations. You know, you're working with pros when they all finish on time. So we are exactly on time, and we have plenty of time for Q&A. So anyone who has any questions, please go ahead and type that into the Q&A box. I do see we've had a few questions typed in so far, and I see one in particular that I think would be great for the group to discuss, and I think I'm going to broaden it a little bit. So the question is, how do you address a question from your audience that you don't know the answer to? And I guess going beyond that, are there any tips for preparing in general for a Q&A session after you've given a talk? Is there something you can do to prepare for that? Any question for any of the speakers? Yeah, John.
So, you know, it's better to admit ignorance than to make stuff up. So to me, one of the most effective responses in that circumstance is to say, that's a really interesting question. I need to think about it and let me respond. You know, let me get your name and I'll respond to you after I've had a chance to consider it. I mean, I think people respect that you're in the midst of, you know, say if you're in a you know, the tension of speaking in a public space, like at a professional meeting, can be pretty stressful, especially if you're starting out. And if you're doing a job talk, everything is just multiplied by orders of magnitude in terms of kind of intensity of the experience. So the main thing is I would encourage people just to say, that's a really great question. I mean, heck, I still do that in my classes now. You know, when if I've, you know, I don't know exactly how to answer that now, but I will respond after I have a chance to think about it, investigate. And in some ways that gives you, I think that's even a more helpful response, and the audience will appreciate it.
I would agree with that, and I might add that it can also be effective to say, is there, you know, to ask whether there's anybody else in the audience who thinks they can respond to that. That's really nice to be able to bring the audience in.
Yeah, that's a great point, Susan.
I think another point, and I agree with all of that, but it's important to try to anticipate questions. You can't anticipate everything, obviously, but you know, you can spend some time thinking about, okay, what haven't I covered here? What are the likely questions that the audience will ask, and how will I respond to them? And maybe there are some holes in your, you know, no research is perfect, and you know what the holes, the difficulties are, the criticisms of your research. So be ready to respond when people bring those up.
You know, so Jim, what do you think about having a slide deck with some potential responses? I'm sorry, Regina, I didn't see that.
Go ahead.
I was just, as a follow-up, what do you think about, if you've anticipated some of those questions, kind of having those in reserve?
Yeah, I mean, some speakers do that. They have kind of an appendix of slides that they don't intend to use unless somebody asks the question, and that's very effective. If they have the response ready and they anticipated the question. Yeah.
I was going to give a perspective if you are talking to a journalist, so it's a little different than what the other panelists were discussing. But when I work as a science journalist, if I'm asking an expert a question, it's lovely if they say, that's a great question, I don't know. And then it falls dead. So in that sort of case, I would encourage restating the question, asking the journalist what it is that they're really after, why they're asking this. If it's honestly something that you don't know, then you can promise and come back. But if it's something related, you can give some answers, and that gives them a quote to work with, or it might go in an interesting direction.
Maybe we'll move on to some other questions here. Another question is it okay to finish a presentation a few minutes earlier? Is it okay to give a talk which is shorter than your allotted time?
I think it depends. You know, if you're giving a talk at the ASA, at the joint statistical meetings, where everything is very timed, and if you finish early, the next speaker can't start until the scheduled time because people are going from room to room, and some people may be coming in right then. So that's an exception. Otherwise, I think it's not a problem. You just leave more time for Q&A.
If you're doing a job talk, it's much worse to go way too long than it is to go a little bit short. You know, the other thing that I would also add, and this was something when Jim was talking about kind of things that he would have in a talk, in addition to we're talking about if you're doing this as a job talk, make sure that you give some idea not only of what you've done, but what's the future. I mean, if I've seen a mistake in some of the job talks in my department over the years, it's someone not having a vision for the future of what what's the promise of their work, or where they see what they're doing might move forward towards. But yeah, there's also kind of the Goldilocks story of it's too hot, it's too cold, it's just right. I mean, if you've got 45 minutes for a job talk and you go 25, that's a problem. If you got 45 and you go 40, that's probably not a problem. So it's some, there's a lot of context that really plays into this.
And this is why practice is so important.
Yeah.
I'm reading the questions here. There's a question for Regina, which is, when communicating to journalists, what do you think is the best way to convey uncertainty from, say, a survey sample on employment or some other demographic survey?
Hey, Chris, great question. And one with I'm gonna try this. I don't know the answer. That's a great question. I'll get back to you. But how about if I answer a related question or talk around this? This is a huge area of research, actually. What is the best way to communicate uncertainty, especially graphically? I tend to like the heat map sorts of things. So if we're talking about, some sort of regression, you don't just have these hard 95%, confidence bands, but a density where it's falling off into whiteness to give this idea that uncertainty is a little bit of a jitter. It's not things just end with this confidence interval. In words, there are good ways to talk about margin of error. And you can follow up with me directly about that. To answer the bigger question, should you talk about uncertainty? Absolutely, yes. It is super important. It doesn't mean that journalists are going to completely understand it or necessarily make it into the final article, but you need to do your due diligence and put this in here. If you can give uncertainty in some sort of context, how it compares to other surveys or examples of what it means, then all the better. And I'm curious if any of my panelists have thoughts for conveying uncertainty to journalists.
Or other audiences.
So Regina, I would just add to what you're saying, that I think that it's damaging to have a false sense of precision. That if a journalist takes away from research or work that you're describing a false sense of precision or accuracy, I think that's part of the problem when you see things like efficacy reports that we're hearing about with vaccines or anything that's being developed, to know that there's some interval of uncertainty, and then making sure that's part of the story that you tell, to say that, now this is not this is maybe part of it is telling it by this example, that if you were going to do another study with this many, you might expect it to be as large as this or as small as that, or just to communicate that idea of an interval nature, or an interval estimate might be one of the ways to address that.
Great. Let's move on to another question. So there's a question from Ezra Kurum, who's teaching an advanced statistics class where the students also present their final projects. One thing the students tend to do is write full sentences on their slides and then read through them and fill out the slides with little or no space left on the slide. So what advice would you have for breaking that habit?
I feel like we all might have one. John, were you going to jump in first?
I was going to say, Regina, I was thinking that some of the things that you suggested, like the 1,000-word or 100-word top words, might be an interesting way to do it. There's an anecdote that about Steve Jobs when Apple was designing its web page, that he said he was going to charge the designers for each pixel they used. I wonder if you gave your class a budget. You have this many words for a slide. I don't care how you use them, but this is how many you can have for this slide. I mean, something that what Regina mentioned, the idea of having a constraint in terms of the words that you use, or the constraint of number of words, or a format that you would constrain. You have this many lines with at most this many lines or words per line. I think requiring them to execute with constraint is one of the ways that you could enforce that.
I think with a student, I would take one of their slides and redo it in a way that is appropriate, and show them, I said, this is the way you want to convey, and then ask them to keep that in mind for the rest of their presentation. You can also tell them, don't make slides like that, but it's helpful more to show them how you can really convey that information by doing one slide for them.
Those are good points. One thing I've done, which is slightly tangential to this question, is that I have students give presentations following the ASA contributed session pattern, where they have 12 minutes plus 3 for questions or something. And so we have 5 talks in an hour and 15 minutes. And I think they found that very helpful, because many of them have ended up going to contributed sessions and presenting. And so
I wanted to underline what Susan said about examples. The more examples, the better. Either taking one of their slides or just proactively coming up with some. And as John pointed out, one of my favorite techniques for working on these things is constrain creativity. So I like the idea of giving them a budget of number of words. Another idea is to only let them use 72-point font, and you can't put it in there. And other ideas around that to force them into something that's really quite impossible. And then when you lift that creative constraint, they'll have a new anchor point.
Great. I think we'll move on to the next question, which I think is quite important for this time in history, which is if you're presenting via Zoom rather than in person, are there particular things that you should pay attention to? Are there differences? What are those differences, and how might one prepare in particular for giving a talk or a presentation on an online platform? versus in person.
I must admit, I've given a couple of talks via Zoom, to other departments and other audiences, and I found it kind of challenging actually not being able to see who I was speaking to, and I don't really know what the answer is for that, but it's something that's new for me, and I'd be interested to know what other people have to say.
I've been thinking about this a lot. I think it's a great question. So I don't necessarily know the answers, but I've been playing around with some things. I feel like interactivity is important. It's always important in any sort of talk to be able to get engagement and buy-in, but even more important when people are in Zoom and they have everything competing for attention, including just multitasking. So how many of you are multitasking right now, right? Like even maybe our panelists are multitasking. So I've made use of Zoom features. It's a little harder to do in a webinar format like this, but if it's set up as a meeting, then you can have a screen annotation and you can let people annotate different things. So I've been giving poll questions and interactivity like that. They have the ability to talk on chat, and I encourage the side chat. I encourage them to use reactions and different things. So I feel like the more interactivity, the better. I give them like intuition quizzes, like, okay, we're gonna stop. What do you think the answer to this is? It may seem simple or pandering, but I feel like we need to be just that much more engaging. And well, I'll just stop there.
Regina, you're a seasoned presenter and instructor. So I think on someone who's going to be giving, we're going to be interviewing for a position in my department virtually this year. And I was just thinking that what you're just describing is a really hard thing for someone who is a less experienced instructor. I mean, one part is a lot of the things that we've recommended about practice carries forward. Do a Zoom call with your friend or someone else, even if they're in the same department. They, set it up and do it this way. Make sure that your technology works. Make sure you figure out how to mute, how to share screens, how you do all of the operations. I mean, we all logged into this call 10 to 15 minutes early to make sure that the technology worked. You would do the same thing with any department you were speaking to. One of the challenges that I think is that in the past, when we've done face-to-face interviews, Jim has mentioned this, that this is a different kind of exchange. But I'll tell you, right, the fact that I'm looking at 4 other humans right now makes me think that I'm interacting in a real way. So if I were going to be doing this for a larger community, I would ask them, to the extent that they feel comfortable, to try to have their screens on so that I can see the faces that I'm talking to. It's instead of me talking at my screen, which is, I certainly have yelled at my TV for over the years, but generally no one else is listening. But I mean, this idea of what can you do to make this feel like a real interaction in presenting, especially if for those of you that are thinking about giving job talks, I mean, this is also an opportunity for you to show how you might act as a presenter, how you might act in a classroom. So, some of Regina's suggestions of like make sure that you insert breakpoints into your talk where you allow for the community to weigh in. I just want to stop here now and make sure that everyone's with me. Do you have any questions about what I've just done there? I mean, just even some things like program into your talk places where you're going to stop. Insert a break slide and make sure that you follow up at that point. I mean, even something as simple as that would help you kind of take a breath, interact and engage with those that are attending.
Those are great suggestions. Looking back at the Q&A, I see a question: is it okay to include a family photo in a job talk, or how personal, how much personal information would be okay to include in a presentation?
I could give you the answer that my OEO office would give you. No. and generally, in fact, when we have people interview for a job in our department, we set up opportunities for them to talk to faculty in other departments about life in the town and the university, because personal aspects, you know, that should not be part of the factors that are being evaluated and considered as part of a hiring process. So we very much have a clean room strategy here, and essentially it doesn't matter what someone's family circumstance is. What matters is, are they able to execute the position's description? So from what we've been told is, no.
Yeah, I would say there's a, you may think that it's seems friendly, but I think there are definitely dangers there, and it's better to avoid them. You don't want to bring in too much of your personal situation. It can make you seem maybe manipulative or, trying to play on emotions perhaps, which is, and you want them to focus on you and your qualifications.
Yeah, once you get the job offer, then that's when you start really exploring all the other issues of life at the institution and what that would mean for your family or significant others.
Good. Let's see, we have a long question in the Q&A box here, so I'm gonna scan through it. So I think the question has to do with sometimes a statistician provides simple and reasonable answers to an audience's question, but then there'll be aggressive questioning to get deeper and see if goals can be reached with less resources, less money, and maybe, or let's say in general, maybe you have an aggressive questioner, and how might you handle a situation like that? And sometimes it's great to get any question, frankly, especially if you're giving a contributed talk at JSM. But maybe maybe somebody's being a little bit too persistent, or is there a way to politely handle that?
I would look to the person chairing the session or the moderator, if it's a panel, with a look that says, help me out of this. We have to do this sometimes at conferences that we sponsor, where somebody asks a question and they go on and on and on and on, and it uses up time for anybody else. And it's really, it's hard for the person who's being asked a question to do something, but a moderator can often step in and say, we've got to, can you finish up the question? So, because we've got other people waiting to ask questions.
Yeah, I agree with that. I've seen this happen occasionally in job talks, and it's almost like harassment of the speaker, and somebody has to step in and say, okay, let's move on.
I don't know if none of you are probably old enough to have been at sessions where Nathan Mantell was in the audience, the great statistician, who was a terror in asking questions at statistical meetings. So he would accost the speaker with things like, I proved that 20 years ago, and give the reference to his paper, or he would tell you that you were completely wrong with what you had done, and give a little. So I could not tell you how to answer a question like that, because those are very difficult. But I don't know whether there are people who do that now. But I remember in those kinds of meetings at ENA or JSM, if Nathan would get up to ask a question, the speaker's knees would be knocking.
Well, you know, part of it is find ways to deflect too. I mean, I think that, you know, it's like, thank you for raising these important issues. These are certainly worth considering. You know, I mean, it's one of those, you know, or I'd say, I'm going to get Regina to meet to take you out behind this alley and take care of you later. So I'll bring my muscle with me here. You know, yeah, but I would find ways to try to diffuse and deflect if the chair doesn't come to your doesn't jump in.
Right. I think that's good advice, because sometimes if you engage, it just, what do I want to say? Accelerates, or, you know, the situation. So, well, we're reaching the end of our time. I think we have maybe 2 more minutes. So maybe I'll just ask a question I had, which would be, how might you prepare for like technology breakdowns or interruptions or things like that? Or, you know, is there a way to gracefully handle those? Maybe the answer is preparation again. Be prepared, be flexible, be adaptable.
Yeah, and you know, don't freak out. You know, I had a little difficulty at the beginning because the way this was set up, it wasn't the way I was used to with Zoom, and you know, the folks helped me 15 minutes before when we were all on early, but the same thing happened again when I started to do my presentation. But I knew somebody would help me out of it. I think it's a little easier when you've been giving talks for decades. You know, you can be a little cooler about it than if it's a major talk you're giving for the first time and something isn't going quite right. It would be more upsetting. But the worst thing that'll happen is that the whole thing goes awry and you won't be able to give your talk, but it's not going to be your fault. So
It's worth asking if they're going to have technology support
yes,
when the meeting begins. I mean,
yeah.
so that's one thing that you could ask if you're put in such a place. You know, as someone who's been teaching a stat programming class and had all the electricity go out in the classroom just before we started, and then taught the whole class on the chalkboard, you know, this kind of stuff's going to happen. But in a technology case, when we're doing if my internet had gone out, this would have been a panel of 3, and that would have been okay. So I think, you know, Susan's point, I think, is well taken. If you ask them if they're going to have technology support, get on early to check to make sure it's running and make sure you understand the connections, and then, you know, and then hope you don't have the electricity go out.
Great. Well, I think we've reached the end of our allotted time, and we'll set an example a good example by finishing on time. As a reminder, so there will be on the NISS website, there'll be a link to a recording of this session that will be available if you'd like to take a look at that again. And I'd like to thank again our speakers for their excellent presentations, excellent tips. I think it's been a really stimulating session, and I appreciate everyone being here. And thank you so much, everyone.